Hi, everybody. How are you? I'm flying solo today. This is Dr. Hutchins from Inspire Wellness. And I have a special guest today, Debbie Radvar. It's been probably like years since you've been here, but you did one of these before with us, I
Yes.
think, and we wanted to introduce
embarrassing.
all the things you do. We should pull that old one up sometime and compare.
Oh, people watch it. It's embarrassing.
All right. So the reason we wanted her to come around is because, well, it was Breast Health Awareness one of these months,
October.
which I think is a little silly because every month should be health awareness of all of your organs. But just because it is October, we thought this would be a good time to
Right.
bring her on and discuss thermography. So people are a lot of times looking for a less invasive way of cancer screening, something that doesn't, in theory, harm cells by smushing and radiating, and not to say that that's not the right thing to do for plenty of people, but to do it over and over and over and over and over again, you might just want to have knowledge of a different technique out there. And there are other things, it turns out, besides just breast health, that the thermography can be useful for too. So if you want, just go ahead and introduce yourself and tell us, like, first of all, what is thermography?
Okay, hi.
And how does it work? Like, do you go to the office? Do you need to be,
Yeah, no,
undressed or what?
No, that's important because people get very nervous. Yeah, so my name is Debbie Radvar. I'm a holistic health practitioner. I work at Reset Lounge in Sugar Falls. I come in here. I used to work here full time. So I do a lot of things, and really I used to go for thermography, and when I would get this report back, it would just have so much information. For example, I had carpal tunnel, and they were going to do surgery, but based on my thermal image, I really had thoracic outlet syndrome. So then...
So that surgery would not have worked for
no,
that.
I would have been one of the many people who it didn't work for. So, but it made sense because I work with my hands all day, so it made sense. But anyway, so thermography is basically an infrared camera. It's digital. It's non-invasive. There's no radiation. And it creates like a map of the body. So we take pictures of specific body parts. If you do a full body, you're doing everything. There's 27 images. If you're doing just breast, lymph, you're still going to get, every angle, so that you can see. You're looking for, it's a temperature test. So it's reading the thermal image of the skin.
So no radiation.
There's
right?
no radiation, and there's no touching. So it's not a compression. I'm about 4 feet away. They're on a stool or standing. It's a dark room, so it's very, you're covered. You have a gown. And people come in. It is a little chilly because we have to keep the temperature at a certain amount. But then I go through and I take images, and then I upload them to a doctor who creates a report. And what's nice about the report is he's looking at the whole body. So it's the initial part, seems a little overwhelming. Like he says everything, but then he reduces it down to the pattern that he sees. So I always tell people, don't freak out, like get to the last page. But what's nice is he gives recommendations. So by the time you find something with a mammogram, you already have a tumor. Where this is going to show, breasts aren't standalone items. So, a lot of times you have dental issues and you have infection. It's draining down. It's compromising the lymphatics. If you have autoimmune issues, if you have, dense breasts, things like that are going to not show up accurately on a mammogram.
Right, how many of us have been told, not me, definitely not me, that you have way too dense breasts, we
Right.
need to do all this extra imaging over and over and over and over again, and you can't just skip to the extra imaging, they make you do the mammogram first
Right.
every time. So
Right.
it can be a lot of radiation for
Or a
people.
lot of time the ultrasound shows a lot, but they won't do that alone.
Right, they will
So
not.
what I like is when people get their mammogram and they get an ultrasound, get this at the same time, and you have a nice baseline. So let me just show a picture, just so it makes a little more sense what we're talking about. So this is a basic image, and you're looking at heat. So white would be the hottest, blue would be the coldest. And so white, that's normal to have, heat under the breast. But you're looking for certain spots.
Or
and you're looking-
asymmetry,
Yeah, you're
right.
looking for symmetry. So again, you're going to see a difference with, I didn't bring all the pictures, but with you have dense breast tissue, or if you have breast implants, you can see right through, which is nice. He
Okay.
can zoom in, like I do this at a baseline span, but he can zoom in and see what's underneath or follow that pattern. So you're going to see things years before it would show up as a tumor. So I think I have this chart next. Yeah, so this is an example. Let's see, let's put that a little closer. This is when it would show up. So, cancer cells, they duplicate rapidly. So within 2 years, that would you'd see on a mammogram. I'm sorry, on a thermography, but it takes, that wouldn't show up on a mammogram for 8 years. Because what you're seeing is the vascularization, the blood flow, that's going to actually fuel the tumor, that's going to create the tumor. And at this point, that's when you can do things like lymphatic drainage or clean, like a liver cleanse, because that's where you break down your hormones, or, stop wearing your underwear or bras, or, you can do something to figure out there's a big correlation between dental health and breast health,
Yep.
which there's many theories behind that, but it's pretty interesting.
Yeah, so don't ignore your infected root canals, people.
Yes. And this is a picture of a man. So less than or I think about 1% of men get breast cancer. But when they do get it, it's usually more advanced because they're not screening and looking for it as much. But also see the mouth, see how much dental inflammation he has there. Another reason that this is a great tool, it's definitely great for breast health and cancer, but I work on people, I do TMJ, and I do a lot of things for TMJ, like cranial sacral and PNF stretching, and it gives me a good image if I can see the heat pattern. I can see if they're clenching or, what the issue is. And it was fun. I was actually working with this group of dentists for a while, and we'd take the picture and they'd run back and do their tests. And a lot of them had subclinical things that weren't showing up in the x-ray, but showed up in the thermogram.
Yeah, and a lot of people these days have high inflammatory markers in their blood, like CRP, and oftentimes we cannot figure out where that's coming from. So a tool like this might be helpful if it's not an obvious source of inflammation. Maybe there is some musculoskeletal injury or dental inflammation or sinus inflammation or something like that would be picked up.
It just takes the guesswork out, because everything's subjective.
I like guesswork. That's what makes my day
And
fun.
actually, from an energy work perspective, I love it because it proves, that's actually the real reason I got this, because I was a guinea pig in someone's thing, and you could see such a difference. And usually you get off the table and you're like, oh, it's in my head. But you could see I had a sciatica,
cool.
huge pain. It looked like a big red apple. When I was done, I didn't feel pain, but then I had just a teeny dot
that's
of
cool.
pain. So
That's
to
cool.
me, and this is another example. So this is acupuncture. They took images every 5 minutes, and you could see the inflammation when you start, and by the end, see how blue it is? Like it
That's
really
cool.
reduced the inflammation. We also did this with
Are you done?
Essential Zen studio. We did it. They have a beamer mat, and we did pictures of people before, and they'd be really inflamed, and then they'd do the beamer mat, and they were like blue. Like it was amazing.
cool.
And the only one who didn't have a dramatic difference was the owner, because she did it every day. She wasn't as inflamed to begin with. So it really shows, anything that you're doing. I think it's a great way. Say we're doing functional medicine, or say you're doing acupuncture. It's just a way to map progress.
Sure.
Because you don't always feel better. All right, what is this? Okay, so this is an example of a brachial plexus entrapment. So someone might come in with pain down their arm, and they try everything and nothing works. But you can see right there, that's the inflammation. So that's the nerve entrapment. So this is a great tool for chiropractors, for sports medicine, for doctors. My daughter once, she was a dancer, and she would have to wear a boot forever, but we could take an image and be like, no, it's better. This is a good example of neuropathy of the fingers. When you're not getting blood flow or nerve flow, it won't even show up. Like sometimes you won't even see a foot or a hand, and you can see it's pretty advanced. But what's nice about this too is you can see what we're doing is working. Like at the end of an appointment, we'll work, like say we're doing isometrics, or the acupuncturist is working on someone, then we can take a picture and be like, okay, that did something. And it's really good, because when you have chronic pain or issues, you're spending so much time and money and energy. So, and you don't always see results. So anything that will give you, some proof.
Yep.
And this one shows an occlusion of the carotid artery. So you can see varicose veins. A lot of times people with leg pain, they're thinking it's knee or this or that, and sometimes it's vascular. And this really helps the doctors to go in to be more specific of what vein they're going to work on.
Okay.
Things like that. So I think that's it.
Cool. Cool. Okay.
Yeah. This is the one we're not sure about, but for whatever reason, and the guy who creates the report, I don't do the report, but the doctors who
You
do
probably
the report, I should have called him to ask this, but it is very consistent with results, that there's always a hypothermia spot over T1, T2 with people with autoimmune.
That's
And sometimes when it's
fascinating.
just green, then we'll find out, like down the road, they do have Hashimoto's, and so here's examples of that. And again, I can't really speak to why that is, but
So
it's
a lot
very
of stuff
consistent.
besides breast health, then, in other words.
Yeah,
that
so you
it
can see structurally, and you're looking for a pattern. And again, what's nice about it, it's just showing blood flow. So you might not, like people say, oh, well, can I see an organ? You can't see it, but you will see a heat pattern over in Oregon, that's an issue. Like someone was having back pain, nothing showed up on her back, but on the front, here she ended up having a kidney infection.
Oh.
But it showed up white and red in that area. So it just gives you information, and then go to the doctor and get more tests. Or it's a great complement to other tests. You say you already had an MRI, or like I said, you have a mammogram. Like I have one friend, she had a tumor. It didn't show up on her mammogram, it didn't show up on the ultrasound, but then it showed up on her x-ray. So it's just one more angle.
It's just a different way to look at things.
Yeah, and it's non-invasive and there's no radiation, so we can do it as much as we want. If I don't send out a report, like, it's very, very cheap,
Cost
free,
effective,
actually,
yeah.
for me to do with
You
clients.
can do you all day long.
Yeah.
All day
So,
long.
yeah, and it's a mobile camera, so I can take it office to office, and it's just a great, fun tool to have. The other thing I was gonna say, what was it? It's one thing I found that I love having it for is people in between their PET scans. It's so stressful. You're waiting for your tests, and it's a way to kind of track your progress and realize, like, okay, what I'm doing, things are getting better, or it's not getting worse.
Just a non-invasive
Because
way of-
mentally, it's huge.
Yeah,
So-
waiting 6 months or a year can
Yeah.
be a lot for people.
It is. And the other thing, there's different companies. When I looked into doing it, there's Metatherm. They're all really good. I chose this company because he has a really comprehensive report. Like, usually I would go, I'd get 4 pictures. You take them to your doctor, they say this is meaningless.
Yeah, it's an overwhelming report for sure, but the more
Right.
information, the better, and then we can always
Right.
help you weed through the
Right,
important
yeah, so it's great with you
but-
guys, because you can read it and kind of make sense of it. Most doctors poo-poo it. It is FDA approved, but for a while, it wasn't getting FDA approval because they were being accused of false positives, but then when they track people 12 years later, they did have breast cancer. So, it is recognized.
And false positives can just be something you can work on. Like I know with me, I did have some lymph congestion in places. Well, I do want to know that
Right.
because I can do maybe more yoga stretches in that area or something like that. Like I know my face was full of
Yeah.
inflammation from my
Yeah,
sinuses,
it's
so I
great
can
for
drain that a
sinus
little bit.
information. You can see a lot with
So-
sinuses, and again, you
Pretty
can
interesting.
see your progress. So this is an example of a report. It's usually many pages.
And they give you the actual pictures too,
Yeah,
so you
so
can
you get
see
your
plus the
pictures,
interpretation.
lots of information. So you're getting full body.
And then
There's the back.
suggestions on things to do
Yeah.
about different.
Like for the back, you can see the low back. He'll measure your hips, shoulders. And then when you do the black and white version, you can literally see, I don't know if you can see that, you can see the veins.
So you can just get breast or you can get your whole body. Those are
Yeah,
the two
yeah. So
choices.
someone the basic one is called Women's Health. It's the whole upper body. So you're getting thyroid, you're getting the face because you're seeing sinuses,
okay.
you're getting the back of the neck, and you're getting the whole body. And you're getting lymphatics, the breast from a bunch of different angles. Full body would just be you adding arms and legs. If
Oh,
you
I
had
didn't
an
realize
issue
that,
with
okay.
Yeah.
So I guess the musculoskeletal issues would be the biggest things for the
Yeah,
arms
and you're also,
legs
but you
and-
can still see the hips even in Women's Health, but again, a lot of times there's a structural imbalance that it's gonna cause a lot of issues. So he does a lot.
Do you remember when I had mine, I think I went down to reset for my last one, and I had a lymph node here. I don't know if you probably don't remember, but
No, I don't.
I had a pretty big lymph node, and, I'm not the kind of person to just run to the hospital, and so I'm like, let me just do a thermography after a few months and really see if it's something I need to worry about. And I remember in the report, like, you had to specifically ask the doctor, please look at this thing I tagged because you didn't comment on it, and he reported back, I didn't comment because there's nothing abnormal there at all. And I was going back and forth in my head. Is this okay? Do I need a real CAT scan or something like that? And it just went away.
Yeah.
So it wasn't anything. It was probably related to something in my mouth or something. But I thought that was fascinating that for me was a huge diagnostic tool. Should I be concerned about this? Should I get a biopsy? What should I do? And when there was like zero heat abnormality in
Right.
that, I don't know, that was good enough for me to not worry
Well,
about it
and what's
too
nice,
much,
just like
but-
with functional medicine, once you get your baseline, you're looking for change.
Oh, that's another thing too.
Everyone's is
So
different.
you can do this again in 6 months from your first one, and that's probably where the real value lies.
Right.
In
Yeah,
comparing
ideally,
the
you're
two.
looking for a thumbprint. So you would do it the first time, full body or Women's Health. I mean, you can always just do a body part, but I always recommend doing everything, or at least Women's Health. And then you do it again in 4 to 6 months, unless he recommends something differently. And then that's your thumbprint, and then you're looking for change from that point on. And what's nice, it's all computerized. So even before, like, I don't know if you can see these numerical values, he's going to measure hottest, coldest. That digital number will change before you even see a color change.
Okay.
So it's all computerized, and then he's speaking to it. So he's talking about everything, and then at the end, what is different from him from other people is he literally gives recommendations, which he's allowed to do, but but it keeps me out of getting in trouble for doing it. So he'll give a whole list of what to do, like
how to
maybe
clean your
health,
gut out a little
or
bit, or
get adjusted,
stretch,
or your hips
yeah,
are
yeah.
off, or because again, things don't drain. It's just like a sewer system. If something's kinked or turned, you're not draining. Your lymphatics are really dependent on flow. So that if there's structural abnormality, if there's tension in the tissue, it's not going to flow. You're not going to heal. So anyway, it's just like a wonderful.
So what else do you do? Because I know I've seen Debbie for a lot of little things.
I do a lot of things.
And people can schedule like a bunch of these things together. Like not just
so the thermal imaging, I usually will come into an office or at Reset. I'll do it on my days there, but I also am going to just start setting up set days quarterly to come in. That way people can do it every year and they know where to find me. But in general, people come in, I usually do 60 or 90 minutes. My first appointment's always 90 minutes. It's not thermography, but I do a mixture of like muscle testing. So I kind of connect the circuits of the body. I do body work. I do cranial psychotherapy, which is just like decompressing the nervous system.
Which we all might need a little bit.
Yeah. I do neuroemotional technique, like different things that help with the nervous system, getting the body out of fight or flight. So I kind of mix a bunch of things together. So I'll muscle test, get the body online, because Western medicine is all about like organs, glands, and chemistry. Eastern medicine is really about the electrical piece of it. So it's really the communication between the organs, glands, and chemistry. So, sort of like when your phone starts glitching, like we're almost like turning it off and turning it back on, or downloading a new app. So we're just reconnecting the circuits. What else do I do? So we do that, and then I go in, I do a lot with releasing the jaw and the neck. I do something called PNF stretching. It's neuromuscular facilitation. But basically it's isometrics that at Reset Lounge, we just started calling it assisted isometric stretch. So it goes in and it tricks the brain into releasing the muscle. So when you're contracting, your muscles are tightening and shortening, and the isometric tricks the brain into thinking it contracted, but we really didn't because we're stopping it. And then it's releasing acetylcholine, which is going to slack out the muscle, and then we can release it. So it's great anywhere, especially like thoracic, body parts, anything that's tight, the IT band, versus digging in to a short muscle. Because then if you're not lengthening the muscle, you're just sort of like massaging a short muscle, where this is going to lengthen, and then you can massage, or then you can do stretching, and you're going to get some release, and then you have more range of motion, which again, you're going to get more blood flow, more electric flow. But the why I love doing it for the jaw, the tongue, the mouth, is C1 is just responsible for so much, and if that's jammed, that's like traffic control for everything. So if that's tight, or if you're clenching, your body thinks you're in fight or flight. So no matter what you're doing to heal, if your body's in fight or flight, you're only going to like sleep enough to run from the bear, digest enough to run from the bear. Like, so it gets you manually out of fight or flight. So I do that, and tapping, EFT, just a mixture of things that kind of
So a lot
work
of
with
lot
the
of
nervous
things
system.
all
Yeah.
together, right? And you can get it all
And it
done
just
at once.
kind
if
of
you
works
want.
together. So whatever people say they come in for, whatever we find is what we work on.
Perfect. I love
So,
that.
yeah.
All right. Well, so we are going to pick a day this coming month to offer it at Inspire Wellness. So you guys that don't live close to Chagrin Falls, don't have too far to go, or patients that are already here, you can easily do. So I don't know if we probably don't have a date yet, but we can write one down.
Yeah.
On the comments here, and like she said, we might try to plan on doing one a quarter here, just to make it easier for people to access this for whatever. It doesn't have to be just thermography.
Yeah, and my website is healthyintegration.net, and so I'll have where I'll be at different locations, and I'll just put you on there, and then I'm at Reset every Wednesday and Thursday. That's in Chagrin Falls.
Great. And Reset also has some other stuff if you guys want to check that out too. It has new calm chairs to also help your nervous system.
Yeah,
it has a
great.
couple good saunas. It has a vibration plate. I don't even remember.
Yeah,
Salt cave.
Salt cave. We have red light therapy now, and we have a Hocket.
Right, I keep
The
forgetting
Hocket's
because I haven't done
amazing.
that
That's
yet.
ozone.
Yeah.
It's wonderful if you're doing any kind of like Lyme or mold detox. It really helps move things through the lymph.
So yeah, check that
and
out
we're doing
too.
Pilates there now. We have an acupuncturist. He's amazing.
Oh, yeah?
Yeah, Jason.
Very cool.
Yeah, he's great.
So you could check the
I know,
acupuncture results with the
it's like
thermography
this healing
camera.
playground. It's really fun. So,
I like that, a healing
yeah,
playground
it's
instead
really
of a
fun.
disease
And it's-
playground.
And it's a very like zen-y place. You walk
Right,
in,
right,
you're just
right.
like, so.
And they have a lot of cool products that they purposefully chose to buy because they believe
Yeah.
in them and stuff like that. So, all right, well, we are out of
Oh,
time.
sorry.
So don't be sorry. No, I'm great.
Okay.
This is great. So anybody just ask questions in the comments or go to her website, healthyintegration.net.
Yep, thank you.
Debbie Radvar again. She will be here next month. We'll pick a day. We'll let all of you know. And once a quarter here, hopefully. And then otherwise, just go check her out at Reset Lounge in Chagrin Falls. And keep thermography in the back of your heads, not only for breast cancer screening, but also for follow-up sometimes too. You know, if you're told you need an MRI every 6 months with dye, which is kind of a heavy-ish metal that stays in your body all the time. So you might want to just maybe even alternate, a thermography with the MRI.
Right.
There's no right rules for people.
Right.
You just have to decide what's best for yourself. But we are here and we're glad to have this as an option. So thank you very much for coming in.
All right, thank you.
All right, have a great day, everybody. Take care.
Thanks.